Hi, today's topic is about posterior pelvic tilt. Posterior pelvic tilt is a condition which is caused by neurological conditions such as stroke, neuromuscular disease, Parkinson's disease, spinal cord injury due to spasticity, tightness, muscular weakness, and neuropathic scoliosis. These are the reasons for posterior pelvic tilt. Firstly, appearance of posterior pelvic tilt. Our pelvis it will be protruded posteriorly, mainly ASIS and PSIS. ASIS and PSIS, we have to, this is an assessment of posterior pelvic tilt. In a neutral pelvic tilt, it will be in a position, but in posterior pelvic tilt, the ASIS moves posteriorly, front of pelvis is rise and back of pelvis drops. This is called posterior pelvic tilt. Muscle involved in posterior pelvic tilt. Mainly, there are four muscles involved: hip flexors, spinal extensors, hip extensors, straight abdominal muscles. In this, two muscles are being lengthened and two muscles will be shortened. The lengthened muscles are hip flexors, iliopsoas, and spinal extensors, erector spinae. This will be lengthened, and the shortened muscles are hip extensors and straight abdominal muscles. And then clinical features. Now we are going to say about the clinical features. Clinical features will be flattened lower back pain and reduced spinal flexibility, low back pain, and hamstrings will be tight. These are the clinical features of posterior pelvic tilt. And main thing in this, we are going to say about the assessment. We have to assess the posterior pelvic tilt. There are many ways to assess the posterior pelvic tilt, mainly postural observation. If we see a person with posterior pelvic tilt in a side view, it is easy to assess the posterior pelvic tilt mainly, and palpation of ASIS and PSIS levels. ASI and PSIS should be in a normal level. If it is tilted posteriorly or anteriorly, it could produce anterior tilt or posterior tilt. And muscle length test, hamstring tightness. The muscle will be shortened, no. So we have to test the length of the muscle, so it could be easy to assess the posterior pelvic tilt. And strength testing, muscles strength. We have to check the strength of the muscle and length of the muscle. Both we have to test to assess the posterior pelvic tilt. And then mainly we have to corrective measures. How shall we correct the posterior pelvic tilt? We have to strengthen the muscle which are weak and stretch the muscle which are tight. So we have to give stretching exercise for hamstring, gluteal muscles, and abdominal muscles. These three we have to give stretching exercise, and strengthening exercise for hip flexors, lumbar extensor, and core stabilization. And mainly we have seen the assessment, postural observation. So we have to postural correction. We have to do the postural correction and functional training. And then mainly there are three types of pelvic tilt: anterior and posterior and lateral. Today we are seeing about posterior pelvic tilt. Now we can see about the neurological conditions briefly. Firstly, cerebral palsy. Cerebral palsy often causes severe pelvic tilts, including oblique, pelvis, and posterior tilts, often linked with hip dislocation and scoliosis. And then stroke. Patients frequently experience altered pelvic alignment, especially anterior tilt, due to spasticity or weakness affecting gait and balance. And then neuromuscular disease. Conditions like Duchenne muscular dystrophy can affect pelvic alignment. And then Parkinson's disease. When primarily causing rigidity, it can lead to postural changes, including pelvic floor dysfunction and tilt associated with overall trunk postural changes. And then lastly, spinal cord injury. Neuropathic scoliosis and severe scoliosis are frequently linked to abnormal pelvic tilts. These are the neurological conditions. Now, what are the reasons of neurological conditions which cause posterior pelvic tilt? Spasticity and tightness. Tight hip flexors or spastic quadratus lumborum muscles pull the pelvis into abnormal positions. And then muscular weakness. Weak gluteal or abdominal muscles fall to maintain a neutral pelvis. This may be the main reasons to cause posterior pelvic tilt. And then neuropathic scoliosis. A crooked spine often causes one side of the pelvis to sit higher than the other. Crooked spine, it means the spine will be in a crooked position. Forwarded bended position is called crooked spine. And the common types are already told: anterior, posterior, and lateral. These are the things about posterior pelvic tilt, and thank you for this opportunity.